of the country, but we all know Belinda as an official working for the Department of Environmental Affairs and Development Planning, where she heads the Waste Policy and Minimisation component. I think her CV was on the invite, so I do not have to read all of that. Her focus areas include waste policy development and implementation, with waste minimisation and the waste economy in the Western Cape. And I think in particularly that she's very passionate about the AHP products and the healthcare risks of waste in the province specifically. So I really want to welcome Belinda and say thank you very much for being willing to share the policy issues around AHP products with us, because I think it's something that we're really concerned about. I think on another note, everybody that knows Belinda knows she's very accessible, very helpful and very supportive towards us and anybody that really wants and needs information. So Belinda, we really look forward to this morning's presentation, and then we will have questions afterwards. Thank you. I'm handing over to you.
Yes, good morning, everyone. And if you just looked at my funny expression now, just trying to get the dogs out of the way. So, yes, welcome to the presentation, and I hope I will do the subject justice. I'd just like to also thank my colleague Yonela Makabeni, who's really assisted me in gathering the information for this presentation. So without further ado, I will then get started. I will also mute my camera because I know some people have, there's load shedding and people have problems with bandwidth. So please forgive me if I put off my camera, but yeah, let us get started. Can everyone see that?
Yes, we can, yes. Belinda.
Okay. So, so my presentation is covering, looking at the policy overview of sanitary waste management in general in South Africa, and obviously we will look at what we're doing in the Western Cape as well. So when we look at sanitary waste management, I will basically look at an understanding of what is sanitary waste and how does it link with absorbent hygiene products. And then just briefly as an introduction, what are the challenges associated with sanitary waste management? And then looking at what are the different policies, legislation, etc., that deals with it. And then just one of our initiatives that we have been driving in the Western Cape around sanitary waste management, with a focus more on looking at the informal settlements and how it is managed there and how it can be improved. And then lastly, I'll end off with our Western Cape Recycling Action Group Sanitary Dignity campaign that we initiated last year. Thank you. Okay. So I think it's important to start by defining sanitary waste. And this was quite difficult because I couldn't pick it up in the waste legislation. And it is only when I found a draft, the proposed draft National Healthcare Risk Waste Management Regulations, which I might add has not been published yet, did I find a definition, at least within the waste context, of sanitary waste. And here they say sanitary waste means soiled napkins, towels, pads, tampons, but not classified as healthcare risk waste unless such waste is waste in isolation. In other words, if it is generated in hospitals, so then it would be classed as healthcare risk waste. And then I also came across another definition of sanitary waste in the Sanitary Dignity Framework policy document, and here they simply refer to it as meaning sanitary products that cannot be reused or recycled. But generally speaking, when one speaks of sanitary waste, one really is speaking now about the full range of AHP products for your diapers, sanitary towels, napkins, tampons, etc. These are all classed as sanitary waste. So when we speak about the framework for sanitary waste management, I'm including all of that. So what is the composition of absorbent hygiene products or sanitary waste? And largely the products consist of wood pulp, fluff pulp, but more importantly, they contain plastic polyethylene, polypropylene resins, etc., and a number of adhesives, which makes them very difficult to manage in the environment. There is a standard for it, but unfortunately, the South African standards, SANS Code 1043, for disposable sanitary pads, and it was published in 2010. But unfortunately, those are not public documents, so unfortunately, I did not have access to that one. But then we also have SANS standards for reusable sanitary napkins as well, and that is again, once again, that is not public, not a public document. But I did have access to the draft SANS standard for menstrual cup, and here again the emphasis is more on the personal hygiene. You know how the product behaves in terms of the personal hygiene of the person using it. So that is a key, but there's no real environmental consideration in the SANS codes. Okay, so when one looks at AHP, it is really a convenient product because it is allowed a lot. It contributes to the comfort and convenience of good hygiene of millions of people on a daily basis. Disposable nappies have lessened the domestic burden for women, and then also allowing girls and women to be very productive and feel comfortable when they have their menstrual periods. And then also in terms of older people with incontinence, it also allowed them a lot more, ability to interact and be productive. So it is a huge convenience when one looks at disposable AHPs, but along with that is also an increasing challenge to manage because while in the formal households, these are not a problem. It gets taken and it gets removed. We sit with a challenge that we have so many informal households where it becomes a huge challenge. So we're looking at a huge generation of AHP waste, and so between 490 to 800,000 tons per annum. And then one, if it looks at the volume of AHPs in South Africa, namely, it's about 7% of municipal solid waste for sanitary pads and 5% of municipal solid waste for baby nappies and 4.05% for adult diapers. So it is quite extensive and it forms quite a big portion of the waste stream. And as we drive as all efforts are to eradicate sanitary poverty, we'll find that this numbers might even increase, and it becomes then further a challenge to manage the waste, especially those of disposable sanitary products. So why is it such a challenge? It's because when one looks at the fact that we have so many informal settlements and we have such a huge housing backlog in the Western Cape. These were figures that were taken recently, but as I speak, these numbers may change. That there are about 1,046 informal settlements in the Western Cape. And I listened this morning on ENCA News, and they were speaking of a similar problem in Durban. So your metros also have a huge challenge with dealing with the provision of effective waste management services for informal settlements. So it's a moving target, the housing backlog, and that in itself presents a huge challenge when just managing sanitary waste effectively. So how is it managed by municipalities? Household AHPs are collected by the municipality as general waste. Sanitary waste tiles in public and business premises are collected by companies. We either dispose of it directly at landfill sites, or in many cases it is treated. It is sent to treatment companies, and then those treatment companies then are obliged to dispose of the residual at a hazardous waste landfill facility. Nappies and sanitary towels often end up, unfortunately, in toilets, dumped in rivers or public open spaces where poor waste management systems are in place, especially in informal settlements. So these are just some of the impacts of potential health risks when it is poorly managed. And it can lead to all kinds of challenges, particularly waterborne diseases, and what our colleagues in our pollution management component as shared with us is that there are extremely high levels of E. coli in the rivers in the Western Cape, particularly when the testing is done close to informal settlements. And it is at such dangerous levels that they even opt not to test immediately at the site, very close to the informal set. They actually shift it further down to have some form of dilution of the material so that it becomes easier to measure. So it's actually quite a dire situation. But more importantly, I think it becomes a bigger crisis when we find that it is the cause of diarrhea, and it has even now been picked up that there's a resistance to the treatment of these of the diarrhea, and particularly amongst children under the age of 5. And so it is the second highest contributor to children under the age of 5 deaths. So it is a real concern when sanitation and sanitary waste management is not of the required standard. And there's been evidence in the newspapers of various various reports around what is happening, kids playing with it, dogs, etc. And it is just really a huge challenge in terms of when it is poorly managed. These are just some of the images that we've encountered, and it really indicates a really dire problem and something that must be dealt with more effectively. Many informal settlements, a skip is usually provided, and through our experience, it is clearly not the best option for managing waste in informal settlements. And hence, obviously the exposure of sanitary waste to all the elements. Many families choose, or individuals choose, not to place their sanitary waste in these containers and nappy waste. And often it ends up in rivers and of course in the environment, and then it creates a huge health challenge for everyone. Also, other potential hazards, when it is collected, it ends up at the landfill site, and it can also then obviously contribute to the contamination of groundwater. But I think a big concern is that it will, because it ends up at the landfill site, we have lots of waste picking happening at landfill sites. And I suppose this is a huge challenge, and this clearly indicates that we need to look at alternative ways in which waste pickers can access material other than at landfill sites, because they are then also clearly exposed to the hazards associated with poor sanitary waste management. So when one looks at the policy framework, one has to look at it in the context of the challenges I've just spoken about. And so if one looks, and I've just broadly glanced over some of the broader policies and legislation that is in place. And actually, one should look at the Sustainable Development Goals, and I guess here we can look at all of them because they all seem to have impact, but 3, 6, and 13 has to do with water and sanitation, health, and obviously in terms of waste management, it is dealt with under the climate response strategies. And then importantly, here is the Constitution, and I'll touch on that, and then looking at the National Environmental Management Act with its core principles and how that is applicable, and then more specifically the National Environmental Management Waste Act. And I will also touch on the National Water Act because there are standards that have been put out by the Department of Water and Sanitation that actually deals with sanitary waste management. So I will touch on that. And then if you're looking at the treatment of it, alternative treatment technologies, I guess the National Environmental Management Air Quality Act will also be very relevant there. And it is also discussed is the occupational health and safety, and then I will touch on our Western Cape Healthcare Waste Management Act and regulations. So just as I mentioned, the Sustainable Development Goals, and I'm sorry that is not very clear, but Goal 3 deals with health and well-being. I think poverty would also be, so probably Goal 1 would also be very relevant, and then 6, which deals with water and sanitation, as I mentioned earlier on, as well as 13, which is climate action, when one looks at the treatment and the recycling and all of that going forward. So what does the Constitution say? Section 24 of the Constitution obviously means that everyone, the Bill of Rights means that everyone has a right to an environment that is not harmful to your health and well-being. And I think that right must be really carefully looked at and preserved. Then in the Constitution also reference is made to Schedule 5B, and here it indicates the responsibility for refuse removal, which is, it delegates that responsibility to municipalities. So municipalities are responsible for refuse removal, refuse dumps, and solid waste disposal, with the emphasis on the refuse removal, because we know that this is a huge challenge when it comes to particularly around problematic areas like informal settlements. So what is the National Environmental Management Act saying, the principles? And I think those principles are very relevant when one looks at the management of sanitary waste. First of all, it indicates to respect, protect, promote, and fulfill the social, economic, and environmental rights of everyone. And it is not taken care of, obviously, those rights are, if the waste is not managed properly and communities don't have access to proper waste management, those rights are definitely not taken care of. It must place people and their needs at the forefront of its concern. And are we doing that now with everybody? Community well-being and empowerment must be promoted through environmental education and the raising of environmental awareness, which is critical to improving the management thereof. And then intergovernmental coordination, harmonization of policies, legislation, and actions relating to the environment. And I think the harmonization is probably going to be important, because as we go look at what the Department of Water and Sanitation is saying around sanitary waste management, there needs to be alignment also with the National Environmental Management Waste Act. And I think what is also important under NEMA is the duty of care, and the whole polluter pays principle, and that is also very relevant. Then one looks at the Waste Act. I think what is important, first of all, is to distinguish between general waste and hazardous waste. And from the definition I've given earlier on, it is clear that sanitary waste is classed as general waste. It is only classed as hazardous waste when, as indicated in the draft national regulations on healthcare waste. It is only when it comes from healthcare institutions, or it is considered isolation waste, that it is hazardous waste, and then there are specific protocols for the management of it. But while it is general waste, it remains in the waste stream, and yet it is not managed that effectively. So NEMWA also, the Waste Act also says that no person may dispose of waste in a manner that is likely to cause pollution of the environment or harm to health and well-being. And also normal household activities covers domestic sanitary waste, meaning that, as I said earlier on, domestic sanitary waste will be disposed of through the municipal waste stream. But Section 16 also refers to the duty in terms of waste management for holders of waste. So municipalities are holders of waste. And where waste must be disposed of, they need to ensure that the waste is treated and disposed of in an environmentally friendly manner. Secondly, also they must manage the waste in such a manner that it does not endanger health or the environment or cause a nuisance through noise, odor, or visual impacts. And I've put these pictures out there because currently these are the types of waste management practices that we encounter. There are scenarios where it is well coordinated and there's good communication with communities and So there are means of removing the waste from, particularly around informal settlements. It is done quite well. But in instances where there's no communication, where skip seems to be the only solution, we have huge challenges around the management thereof. So when one looks at the national waste collection standards, there are also key principles that must be adhered to here: equity, affordability, clarity and ease of implementation, practicality, and very important, co-design with communities. So the standards advocate for the collection on site, and what they also indicate that community transfer to collection points, or there's organized transfer to collection points. Now, these provisions are there, but unfortunately, because there's not been enough engagement, I believe, with communities, it is not often transferred in the manner that it should be in terms of the standards. Then there's a national policy for the provision of basic removal services for indigent communities. And here again, the provision is to the adoption of the free basic services policy. And the policy speaks of a critical need for uniformity in the range of refuse and collection services available, provides for basic refuse collection service as per domestic collection standards, the ones that I just spoke about now. However, the policy does not make, again, provision for the separation or separate collection of sanitary waste, as not in the standards as well, the collection standards that I spoke about previously. Then when one looks at treatment and disposal of sanitary waste, if one considers treatment, then one needs to look at the listed activities. For example, if there's going to be any treatment technology, we need to ensure that it doesn't trigger a listed activity. And if it does, it means obviously that a full environmental impact assessment or basic assessment needs to be conducted. Because it is considered general waste, if there will be collection or different types, alternative strategies to manage it. If it is going to be stored, then obviously the norms and standards for storage must be considered. Government Notice 926. And going forward in the future, if there's any possibility of developing disposable products that are compostable, then obviously those standards will be applicable. And if there's treatment and if there's any burning technology or incineration of this product, then obviously the Equality Act and they have listed activities that must also be taken into account when applying the technology or when deciding to introduce the type of technology. And then when one looks at disposal of sanitary waste, the relevant legislation, there's the national norms and standards for the disposal of waste to landfill. And because it is considered domestic waste, it has to be disposed of at a Class B landfill site. So there are liners, etc., in place too, and that is obviously to prevent groundwater contamination. And then very importantly, the National Waste Management Strategy also refers to the management of absorbent hygiene products, and they acknowledge that it is a growing problem, and the high volumes and amount of time that they take to degrade because of the plastics, etc., that the product is made of. And obviously they represent a huge risk, particularly on unlined landfills and to waste pickers. And what they propose measures to address the risks include product design measures and through recycling and alternative waste treatment options. So the improved management of AHP requires consumer awareness and measures to separate these products at source, which may be difficult to achieve in some circumstances. And of course, this should all be preceded by safe collection and disposal of the product. The National Waste Management Strategies targets that they put forward, it was the development and to develop and implement a strategy and standards relating to the design and disposal of AHPs, such as baby and adult diapers and feminine care products. And so the National Department of Environmental Affairs on track with this strategy, and they've held a number of workshops in the past. And some of the key stakeholder engagements alluded to product design, the recycling of pre-consumer waste, develop diaper disposal guidelines and posters, and the suggestion to train brand ambassadors, engage with pregnant and new moms in clinics and hospitals, and maybe even have outreach programs in the informal settlements, share information through social media such as Facebook and Twitter, and investigation into the feasibility of introducing a recycling technology into South Africa. So yeah, so these were the obviously the recommendations that were made, and I know that the National Department now has a draft situational analysis, and they are well on their way to developing this strategy. When one looks at the Western Cape Healthcare Waste Management Act and regulations, and I mention this because I think in the absence of the national healthcare waste management regulations, if one looks at the management of sanitary waste in the Western Cape, it's important to note that that we only regard sanitary waste generated in healthcare. So all sanitary waste generated in healthcare facilities are regarded as healthcare waste. So any treatment company, sanitary waste collection company that is collecting from a healthcare facility, they must regard that healthcare waste as, that sanitary waste or nappy waste as healthcare waste. And only soiled nappies, and once again, our legislation says that only the soiled nappies and sanitary waste of infected patients are regarded as infectious waste. But in order to minimize the risk, we have taken the decision that all waste emanating from these facilities must be treated, because there is very difficult to separate the two in a healthcare facility. And what is important around the management of that waste is that the waste, the healthcare waste, must be treated at a registered healthcare waste treatment facility, who has to report to our department. In others, they need to register on our integrated pollutant and waste information system. And the treated healthcare waste must be disposed of at a hazardous waste disposal facility. But the Act does not apply to households, so it applies only to those healthcare waste facilities where healthcare waste is generated. So further to understanding the policy framework, one is also need to take into account the Occupational Health and Safety Act, because this Act gives workers the right to a healthy and safe working environment. And therefore, it compels employers to make the necessary provisions in the workplace to ensure safe and healthy, that it is the workplace is safe and healthy, and mustn't endanger no workers must be endangered or have potential access to dangerous or to risk waste for that matter. And therefore, employers must provide protective clothing and equipment where necessary, and reduce any dangers to a minimum before issuing protective clothing. But I think what was more important is that because of the occupational health and safety, we find that these containers are available in most workplaces, and it really does help with in terms of the dignity of the management of particularly menstrual hygiene products. So, but this is obviously not available in all environments, and it becomes a problem, particularly if one looks at public shared facilities in informal settlements where there's absolutely no, these bins are not provided to for those communal toilets, and it becomes a huge challenge in managing that. Then we move away from the legislation that is coming from NEMA and the Waste Act, and we look at what is the National Water Act saying. And I think here again, the focus that I've just highlighted is around pollution prevention and the polluter pays principle. So whoever creates pollution, they are responsible for ensuring and will hold accountable to ensure that they implement measures to prevent pollution from taking place. But within the Department of Water and Sanitation, they also have a number of policies that relates to the disposal of sanitary waste. And this one particular policy on disposal of sanitary waste here, it is more focused on the technologies. And at the time, I know incineration is the preferred technology for the management of it. But they do obviously allow for different types of technology as long as they conform to the necessary environmental standards. But what is also important that they also have a national sanitation policy, which was published in 2016, which has a number of pillars. And the pillars clearly state here there's a right to access basic sanitation. And secondly, prioritizing hygiene and end-user education is also important. Prioritizing basic sanitation services to vulnerable people and unserviced households. And I think this particularly is applicable again to particularly around the informality. It also has to adopt a people-centered and demand-driven sanitation service provision, and they also have the principle of polluter pays. And then we have national norms and standards for domestic water and sanitation. This also comes from the Department of Water Sanitation. And here clearly they also make reference to solid waste management, where they say that sanitation services shall advocate and assist with effective and sustainable solid waste management practices to prevent pollution of the environment and to protect public health and water resources. And then in terms of the norms and standards, the goal here is sanitation services shall advocate and assist with effective and sustainable solid waste management. And here they refer to households, where they indicate how they should, in terms of the collection, it should at least once a week or the waste should be collected from households. They refer here to the burning or incineration on-site of household sanitary waste, which we are concerned about because it's not necessarily aligned to what the Waste Act is saying. If one looks at the third provision here, it says children nappies shall be disposed of by directly covering them with earth. Disposal sites shall be fenced off to prevent accident and access to children and animals. And I think there needs to be a lot more discussion around this because there needs to be harmonization once again with what has been advocated in the Waste Act and the collection standards and what is being proposed in these norms and standards. Furthermore, there's also provisions for menstruation consideration, and here they say that women and girls of menstruating age must have access to suitable materials for the absorption and disposal of menstrual blood. Women and girls must be consulted on what is culturally appropriate, and I think that is absolutely important as going forward in finding solutions. And they say here that toilets must include provision for appropriate disposal of menstrual material, waste bins with lids that are emptied regularly, or private washing facilities. And clearly, these provisions are there, but it is not necessarily applied, in all circumstances. And it's something that we need to really look at and so the provisions are there, but yeah, the implementation is a challenge. And then I'd like to draw your attention to the sanitary dignity framework, and that is the last bit of policy that of the range of policies that I have looked at. And here the aim of this policy framework is to promote sanitary dignity and to provide norms and standards in respect of the provision of sanitary products to indigent persons. And they have special waste management provisions, and these include indigent persons must be educated on safe options for the disposal of sanitary products, especially those used for menstrual hygiene purposes. It also indicates that sanitary products must be disposed of in a manner that avoids direct human contact with minimum environmental pollution. The framework recognizes the responsibility of the municipality as the primary service provider in respect of waste management, waste collection. And additionally, the framework states that where the municipality service is not available, that they would look at the schools to provide the service. And yeah, that is something obviously that we need to look at, because the waste, I think the Constitution is very clear about the responsibilities of municipalities, and the Waste Act is also clear in terms of the collection standards and what the obligations are of municipalities. It further proposes that disposal must be done by means of deep burial, composting, pit burning, or incineration where municipal dump sites are not available. And again, this might be in contravention of the Waste Act, where it is clearly an offence to burn any form of waste. So again, we really need to advocate for the harmonization of all of these policies, and so it is alignment. But what the Department of Women, Youth and Children have made very clear through the Sanitary Dignity initiative is menstrual health management. And I think they've really set it out very well in this illustration here. Because first of all, it is about appropriate menstrual materials, having access to them. Also, additional supportive materials for the storage, washing and drying, and how it needs to be used. And then I think what is critical here is the safe and private toilet and bathing facilities for changing, washing and drying menstrual materials, and the convenience and privacy, I think, of disposal options for menstrual waste. And then, of course, the waste management system in place for menstrual waste. And this is clearly something that is not in place at the moment. We had done a SNAP survey amongst our waste managers in the Western Cape, and that we have done pretty well in general with waste management. But based on the SNAP survey, we have not come across, or there's probably one or two municipalities of the 25 that actually have special initiatives in place around the management of sanitary waste. So clearly, there's a need for advocacy, there's a need for collaboration, and there's definitely a need for more awareness around the management of this, that I think we as government agencies need to engage with each other and find amicable solutions to the problem. Then just in terms, it is heartening to note that there are a number of task teams that are currently being established and are planning events. There are some interesting new technologies that are available out there that are to be tested. And I know there's a Women's Day event on the 11th of August, and it is to highlight the impact of unsafe disposal or used menstrual hygiene products and broaden the discussion around menstrual hygiene management with the aim of balancing increased access and safe disposal. And then they also will be introducing the SHE. It's a type of technology as an option for safe hygiene disposal. And we would be very eager to engage with them and be part of these discussions going forward. And I think if there is that collaboration, I'm sure that going forward that we will find at least be moving forward in the better management of sanitary waste in not only in the Western Cape but in the country. So just to give you some insights into what we had been doing in the Western Cape, we are trying to address the challenge of sanitary waste management through mostly engaging with communities. And so we worked with the Kailicha community in the Cedarburg municipality, and it was very heartening, to have discussions at the round table and to hear and understand what the issues are of communities and what are the cultural beliefs and how they perceive better management of sanitary waste, and how they came up also with some brilliant solutions into how they feel it should be managed. But it was also creating that safe and comfortable space for women to engage and come up with ideas around how it could be managed. We also used this opportunity to promote reusable products, but our concern around the reusable products is that while they are excellent, there's still that need for access to clean water to manage that. And when you are faced in some communities where that is even a challenge, even promoting a reusable might not always be a solution because of all the other constraints that certain communities have to contend with. So this is just an image of the ladies, and as I said, we also use as an opportunity to distribute sanitary products to the ladies, and yeah, we had a very successful engagement, and we're still engaging with the community because it's quite a lengthy process. And then just another initiative that was driven by the Western Cape Recycling Action Group. We had a sanitary dignity campaign. And here it was about, we discovered through our various stakeholders that the women waste pickers throughout the province, many of them there was really a dire need for sanitary products for them because many of them don't earn, they don't earn, they're really at the lowest level of in terms of poverty. And we then initiated the drive with our RAG partners to ensure that we access as many of the women waste pickers, mostly at the landfill sites, and distribute products to them. But we also use the opportunity to, around reusables, and also to have a little bit of talk and educating them around menstrual health and the use of these reusable pads that were distributed to them. And I would like to also then just mention that without the absolute generous support from our industry partners, Petco, the PRO Petco and Polyco really donated generously towards this campaign. And then some of our SMMEs out there and others, stakeholder partners like Brassica and Recycle First, who really reached out and donated and really contributed to the success of this campaign. We managed to reach over 300 ladies, women waste pickers, and yeah, and I think it was, and also going to the various landfill sites. You can see here the amount of products that were donated. Various items were placed in bags, and it included yours disposables as well as reusables, soap, and various other products as well, body sprays and etc., just to improve, not only just in terms of menstrual material, but as well as other hygiene products for them. So they were extremely grateful for these materials that were provided. And then these are the municipalities that we've covered. We've actually moved way beyond the 300. I can't give you the exact figure right now, but we are still handing out products to women waste pickers as we encounter them on our when we do go out to municipalities or to various sites in the province. And these are just some of the images of our engagements. We went to the landfill sites. We did a little bit of education. We provided from Vredendal right through to we reached as far as Beto along the N2. I think the only place we didn't get to was the Central Karoo. But yes, we've been to Oudtshoorn. We've had a great engagement in Mossel Bay. The mayor opened, and there were some great talks with the ladies. And these ladies came from, I think it was Mossel Bay, it was Neisner, as well as George that attended these engagements. They were actually bussed in to come and spend the day with us. And yeah, we just went across the province and made sure that we got to as many of the ladies out there, and everybody was so grateful and excited to receive the product. And I think we have definitely created, in terms of the awareness around the whole management of the waste stuff. Yeah, and that is all from my side. yeah, if there be any questions, please feel free to ask. Thanks.
Wow, that was amazing, Belinda. Thank you so much. What a great presentation. Yeah, and I think there's quite a lot of comments and questions generated from that, from myself, but from the group as well. If you would like to ask a question or have any comments, please put your hand up, and we can give you opportunity. To start off with, Dean Gilberts has asked, would AHP generated at old age homes, frail care facilities be classified as domestic waste or hazardous waste, HCRW? Belinda?
Yes, look, what we discovered in the frail care, it is mostly incontinence. And so we don't regard that as being healthcare risk waste. And I think we've had a discussion with many of the aged facilities out there, because it becomes a huge cost implication when they're all regarded as healthcare risk waste. So that is the stand that we have taken around that, the management of it, particularly when we're talking about these old age facilities. Yeah. I hope that answers, Dean.
Yes, thank you. I think it is a bit of a problem though. And, again, perhaps, assessing the scope and categorization of it in terms of the growing problem. So it's just in terms of quantity. For old age frail care facilities, would it not be also wise in terms of growth and forecasting of population growth? Would it not be wise to sort of look at how that collectively would impact and how it should be better managed going forward?
Absolutely. I mean, look, obviously, we really need to look at, as I said earlier on, the whole promotion of reusables, particularly where there's easy access to clean water, to washing facilities. Those are things that we need to look at because, yes, as our population ages and people live longer, there's a greater, there's a greater chance that there'll be definitely a lot more use of AHPs amongst the older the aging population, and because many of them obviously be able to function more effectively through that. Being able, promoting reusables if possible, and then yeah, it will definitely add to the quantum of these waste products. And yes, we need to probably look at what are the alternative ways of managing the waste. Just sending it to a landfill might be a challenge in itself going forward. So we need to explore other technologies as well.
Thanks so much, Belinda. Don Govender also responded. He said that the costs of reclassifying it in terms of waste management costs from the frail care facility might increase the costs for old age homes and frail care. So that also is something to consider. But I mean, this is also in terms of policy. One would want to know how the manufacturer and the sort of life cycle of a AHP product could be deemed responsible, where the manufacturers are held accountable for that, closing that loop. In terms of those costs, if we want to reclassify and have a higher a more robust management system of the waste, would the costs be absorbed through a fee or a levy allocated to the management to manufacturers?
I think it's obviously now the big concern for me is that I didn't have access to the actual standards because they are not compulsory standards at the moment, and they're not in the public space. But I think going forward, we must also look at in terms of where do we, and I think the National Department might be considering also extending the EPR regulation because we need some other mechanisms to fund the management of the sanitary waste, and through the EPR extending it possibly to a sector that is currently not it's not part of the EPR regulations. There's definitely a need for funding to manage the waste stuff better, and government needs to look at alternative ways in which this can be done. And then the suggestion is, that we look at possibly the EPR regulations.
Yes, I think there's a major opportunity for change in that sector in terms of reallocating some of the responsibility and evaluating it, especially in terms of components in the manufacturing process, to look at how redesigning different materials that you use could be less impactful as well on the environment and people. So I think there's great opportunity for that. Why are the regulations or those standards not public?
This is in fact, I won't lie to you, this morning I was still hoping to get my hands on a copy of that. It is not compulsory. First of all, it is not compulsory for manufacturers to comply with them, and then hopefully going forward that it will become that, and then I suppose it will be a lot more possibly come into the public domain. But yeah, the South African Bureau of Standards, they I don't know why the charge is there, but it is, and I couldn't access it, as I said, just before this presentation. And going forward, we might have to either use our purchase it as a department, or even look at ways in which we can speak to our national department for engagement with them. But I don't understand why there's a cost.
Yeah, it's very strange. I mean, you should be able to, especially in terms of community and public engagements in those regulations, there should be some sort of public availability to those documents for review, especially when you want to look at management around those and opportunities to manage those. Like, as you said, there's probably in those documents, guidelines or, information that could help inform this process of AHP management in South Africa. So it is a bit strange that it doesn't have access. We don't have access to that. So Dean has also got another comment. Dean Gilbert, he was wondering, in terms of infected persons or people that have are sick and they're using antibiotics, or even in the domestic system, would those considerations not leverage the reclassification of the domestic waste to HCRW waste?
I think the big problem is around the funding of the mandate. Because when it becomes healthcare risk waste, it has a huge financial implication. And yes, I think ideally that would be probably a better way of classifying it, but then it is difficult to be able to manage it, or for example for house. That's why in the Western Cape we do not these healthcare risk waste generated in households, but we can't criminalize households. So hence, it could be a huge challenge to do that, and it might, as I said, we have wonderful policies in this country, and clearly there are provisions for management of waste. If one looks at what was presented earlier on, it is in place, but it's just that the mandates are just not funded very well, and hence it becomes a challenge. So declaring it a healthcare risk waste will have huge cost implications. But again, where is the funding then? And there are special mechanisms that would have to be in place across the board to be able to extract it, etc., and treat it as healthcare risk waste, in my opinion.
Yeah. Yes, yeah. No, I think it is tricky. One has to look at the opportunity costs and the long-term costs as well, in line with what the cost would be to reclassify it in terms of towards better HP management. So that's also another consideration. If you look at antibiotics alone in terms of, you know, the levels of those on and ibuprofen and paracetamol and how much of that is in our rivers because of through sewage systems and those sort of things, it's quite high just on that on its own. But if you look at AHP waste and everything around there, you know, one would want to think, okay, what is that cost to the environment and people in the long term, and then measure out those costs for reclassification. Would the costs of reclassifying it and changing mandates and processes be more or less in terms of the long-term impacts that AHP, especially considering growing populations and everything related to that? What are those costs? So, you know, one would also, I don't know, have to consider that. And I'm sure, well, I don't know, are those sort of costs evaluated within policy governments when these are being prepared or reconsidered?
Definitely, you know, regulatory impact assessments are always done. And part of that assessment, one would imagine there's a costing of the policy that is done. But one is to also bear in mind that the problem exists, and I think declaring it a healthcare risk waste is not going to resolve the challenges that we sit with in informal settlements and the growing escalation of these settlements and not being able to, you know, the housing crisis, and I think we need to look at a broad range of interventions to address the problem, and I don't believe that just declaring it as a healthcare space would necessarily solve that challenge.
Absolutely. I think I agree with you that it needs to be a multidisciplinary sort of approach, an integrated approach on using different mechanisms. I mean, as you said, I also agree, and I'm sure everyone is aware now from your presentation that there is a lot of provisions across the different legislative acts. Unfortunately, you know, the fragmentation of these different acts and where it lies across, you know, you almost need a body to sort of or you know, a system to amalgamate those so that, you know, the AHP or just general solid waste management in South Africa, but in specific AHP waste here, can be better managed or better implemented and governed using those different legislative acts. So yeah, I agree. I think the system of actually implementing legislation should also be a priority. But how do you as in government go about doing that, you know, knowing that the legislation is there, knowing that there are provisions, but then, as you say, having resources or capacity to link those up and implement them, that's the limitation. So, I mean, what are the sort of solutions within government to address those?
I think the One Health approach is helping a lot because it's bringing us together. You know, I know the Department of Water, the Water Services Commission, the Department of Women, Youth and Children, they are definitely, I would say they're leading the field in terms of looking at this, but the fact that they're engaging with us, I think is the first step that we, the various different departments definitely need to engage, and you need to have a joint strategy that all of these departments, you know, particularly, I mean, if you're talking about waste management in the sanitary dignity framework, it needs to be landed. It needs to be, there needs to be advocacy to get it into the waste space because it is in a framework, but it's not necessarily being engaged with by waste managers. And so there's definitely that need for communication and you know, and getting people to really, you know, start breaking. And we're talking about silos for years, but now more than ever, we need to really plan effectively so that those silos are broken, that we really start having an integrated approach to addressing the problem, because that is what it's needed here.
Great, thanks so much, Belinda. Hugh has his hand up. You're welcome to come through, Hugh.
Thanks. Thank you. Thanks, Belinda. That's extremely comprehensive. And on that point of bringing the three key municipal departments together to because it goes through all of them. It's a waste department, water and sanitation, and environmental health. And as you know, we've been tasked by the disposable diaper manufacturer to implement a pilot, which we're doing in Langa. And we approached the solid waste department, the urban waste department, and the moment accumulated nappy waste comes up, there's a sort of it's not as you know, so it's been extremely difficult to for them to be able to deal with it. And water and sanitation, they also have a similar problem because it blocks the toilets and it causes sewage effluent into the streets. So my question is, and my challenge to you is, why does the province and yourself bring those parties together in particular circumstances where there, for example, a pilot or a need in a certain municipality who has the appetite to bring those parties together to at least make precedents about how they can work together. Because there's pointing fingers between the two. No, it's not our problems. It's not actually waste. It's actually waters. And so, is there an initiative at provincial level to provide the kind of synergistic framework for those parties to come together to lead the way for others?
Yes, I'm so glad you mentioned this now, because this was definitely a discussion that we had with our senior managers, and it's definitely something that we have a waste management officers forum, and it will be taking place in August, and this will definitely be one of the topics on the agenda. So there's no reason not to accept the waste, because as I indicated earlier on, if you're looking at the norms and standards for disposal of waste to landfill, sanitary waste, nappies are regarded as general waste. And it is clear in terms of those standards where it can be disposed of. So I think a lot of the municipalities are really they are really scared when it comes to compliance issues. And then as long as there's a discussion and there's harmonization in terms of understanding around what can be allowed, what, and those are the types of, because the important thing to note is that sanitary waste management has never, it was never a separate discussion, and we've really now starting to highlight the issue. And I think at going forward, there'll be a lot more discussion at a waste management officers level, and there'll be a lot more engagement around it. So I'm sure we'll be able to find solutions in terms of having a common understanding of what is permissible and what is not, and how do we then deal with it.
Okay, thanks very much, Belinda. I look forward to your progress on that. That'll be great. Thank you.
Thanks, Hugh, and thanks, Belinda. Don has also got a question in the chat box. He asks, I might just adjust your question, but have you come across any case studies in other countries or cities successful of SOS collection and recycling of AHP? And I suppose, if just to expand on that, if you come across any studies or use the successful sort of recycling, reusable, various waste treatment processes for AHP material on top of that from other countries, which you referred to in terms of informing management of AHP waste in South Africa or in Western Cape?
I must admit that I'm not the expert on all of these issues. My focus was primarily on the policy environment, but I know our national department, I don't know if any of them are present here today, would like Kagiso. I don't know if you are with us in the house today, maybe, because I know they have conducted a situational analysis and they are in the process of developing a strategy. And then I'm sure, obviously one would like to be able to look at what is happening in Africa, and if there are good models, in terms of how it is managed. I guess, that is definitely something that will be very helpful, because I think it's also about finding the appropriate examples, and where one can draw parallels and understand, where certain technologies will be most appropriate for our scenario. So I don't know if any of our colleagues from the national department would like to, or any other, maybe the Department of Women, Youth and Children, if they are present, would they like to have perhaps respond?
Is there anyone that would like to respond for that? Available on the chats or on this webinar? I mean, I also think it's important to realize that, you know, these webinars or this information, you know, it's building up information towards solutions. So, you know, we don't have to have all the answers and perhaps gather information going forward. So, yeah, but thank you for your question. We can build up on that information. Then you know, in terms 87 kids, sorry, I don't know if you have 87 kids and your name is not on there. So sorry about that if I'm referring to you correctly or incorrectly. But how are the opportunities implemented to implement solutions tendered for? And I suppose so waste contracting services for the different categories of waste. How are they tendered for? I suppose that a document for the waste removal service is advertised, and then an agency would come and request outside, especially in informal areas, especially, I mean, in our case, a lot of the contracted services for waste removal in informal areas and rural areas is subcontracted to outside of the municipality. So I suppose you would also follow a similar system, am I right? And did I get your question correct as well?
And can I respond to that?
Sorry, yes, please, Belinda.
Look, obviously now sanitary waste management is there's a lot of initiatives on the go, and I think as a department, and we've often done this in the past, is that we often showcase, we create platforms to showcase different technologies, and clearly there's a need for that now. I know the initiative that I've indicated from the Department of Human, the Waters, the Water Commission, on the 11th of August will be one of those opportunities to showcase the technology. But we will also, going forward, would like to create platforms and opportunities to showcase different types of technologies. But as you rightly said, you know, if you tender, municipalities going forward might want to then look at alternative treatment technologies for the management of it. And in that case, yeah, if your technology is well tested, and that's the important thing, it's about the compliance of your technology. So you need to really do your homework, engage with the various government agencies, departments out. For example, if it's in the Western Cape, it will be us, our pollution component as well, air quality, to make sure that if it's a burn technology, that it is compliant with initially legislation, you know, and that at least that is all in place before you you know, find yourself in a position to be able to tender, should those tenders arise in the municipal space. I see there's a hand up, I don't know.
Thanks,
Thank
Belinda.
you. That is my name.
Yes, yeah. So please.
Sorry, Sharice.
No problem.
It is my name as well, Sharice.
Oh.
That's why I had my company displayed as 87 kids.
Okay.
Thank you so much, Belinda. Would it be possible? How is it possible to get on the forum for the event for the 11th of August?
I'm also invited to this. It's the first time that we are very excited to be part of it, and so definitely be getting in touch with the definitely leave your details in the chat, and we can, or I'll put you in touch with the organizers of the event.
Perfect. Thank you very much.
On that, Belinda, I wonder, is it possible if you could share it on the group? I don't know how open it is, that maybe other people on this meeting would also like to attend if possible. So I don't know. Is it?
I would like to know if they are present, because I assume that they are in the house, or they would have attended this one. But if not, I unfortunately don't have the contact details with me right now. Yeah, I'll have to ask one of my colleagues, Yonella, if you are available. Are you on?
Yes, I'm here, Belinda. I will share the invitation with everyone that wants to attend.
Okay, that will be fantastic. Thanks. Thanks,
Great,
Jonah.
thanks so much. Great. So Don Govender has put a comment in the chat box. The current challenge is leakage of AHPs into the environment due to absence of waste management in rural and informal settlements. If we can start addressing this by implementing waste management systems in these areas, that would be a big win. I think as well, that's probably one of the biggest challenges, and it links to our previous discussion in terms of contracting services. My experience is a lot of contracts that are provided through the municipality to remove waste in these areas are often subcontracted to other contractors by that contracting services. And my question around that, and I suppose links to just expanding on Don's comment then, is that what is the sort of management from the municipality side who provide those contracts in terms of monitoring those contractors and the efficacy of the waste removal? I suppose that's probably one of the biggest areas of change, is that we often find that it's the subcontracting services that are actually often dumping the waste. They don't have the right equipment to be able to manage waste. Often they're removing waste in small buckies, and that doesn't really work, and they often leave then specifically leave nappies or sanitary waste products because of the weight and volume of it and the amount of then costs around moving those to landfill sites. So I think one of the biggest opportunities and one of the biggest problems in these areas is that the management of those contractors from the municipality to ensure that that the contracting services are being complied with as outlined by their contract. What are opportunities in there? What are the limitations that doesn't seem to be happening in terms of making sure that those contracting services are compliant in terms of the service that they're providing?
I think the big problem in a lot of municipalities across the country, that there are not even, in some, there are municipalities where there are no waste management services. One needs to say that. One needs to acknowledge that exists. And, it boils down to governance issues and there are all kinds of challenges. And I'm sure one just needs to listen to the news to understand there's a lot of challenges. So basic waste management services are not, although, I mean, perfect policies are in place, collection standards are in place, but there are challenges, and I must admit that in the Western Cape, we're very fortunate that a basic waste management service is being provided, irrespective of the quality of that service. That can be questioned in terms of certain communities, but there is something in place. But we know across the country there are situations where there are absolutely no services. And so, yeah, I agree with Mr. Governor in terms of just getting the basics right first, and then, then hopefully we will be able to even go further and tackle such complex issues as the management of sanitary waste. But yes, we need to start with somewhere, and just getting the basics right would probably be where we need to start. Yeah.
Great, thank you. I mean, I think there's also opportunity, through this process is to actually, I know that there was a task team. I don't know if the task team is still operational within government, but actually looking at a priority scale in terms of interventions and basing them on the lowest hanging fruit, going upwards to more difficult tasks. And, as you said, I think actually getting the management on the ground of our current systems would probably be, the most effective. So until, policies and procedures and funding and resources are being able to get allocated to redo policies as well as implement different sort of treatment mechanisms. So, yeah, I think, as you say, like if we could just get those sort of existing systems right, that would already make a huge difference, I think, in the rural and informal areas where a lot of the waste is being dumped in the watercourses. But I think you're right. I think there's a lot of places that don't have waste management services, and I absolutely agree with you. That needs to be acknowledged, because unless we acknowledge it, we can't actually manage it. So, a plan has to be put in place to be able to put a plan together to address those areas that don't have waste service. So thank you very much for that. Dean has responded to, sorry, Rudy? Yes? Yes.
So there was a question by Lena Stofili that I think we just need, I said we're going to miss it. A little bit before Don, where it was asked about the manufacturers. Can you did you
Yes.
see it?
Yes, I did see it. Sorry, I did look at it, and we did speak about the manufacturers in terms of accountability of costs earlier on. But yes, Lena said, is the regulation looking at ways to keep manufacturers of sanitary products accountable for the bearing of costs of destroying sanitary waste solutions to the waste stream generated from this? We did bring that up earlier. And yeah, but Belinda, I don't know if you want to just expand in response for Lena's comments or questions.
Is it regular waste? Look, as I said earlier on, the national department, they obviously are looking at all kinds of options, and definitely when one implements the EPR, that is one option. But the other one is to have compulsory standards, and once you have compulsory standards, then there's a way of enforcing it. So I think there's a lot of work that needs to be done around sanitary waste management, and I know the strategy that they are currently working on, and I'm sure they'll be having stakeholder engagements where these things can be highlighted again, and and so to ensure that the strategy that is put forward is addresses these issues. So if there's a need for for compulsory standards to be set out, that or if there's a need to ensure that there's sufficient funds for the proper management and recovery of out of the waste stream, and the proper management and treatment thereof, then I guess that is something that will be looked at in the strategy.
Thanks so much. And I think the manufacturers have thank you, Rini, for highlighting that, and Lena. I think the manufacturers have a very key role to play in this, not only in assisting with costs and processes to manage the end use of their products, but also in the redesigning and raw material basis and everything else that goes into AHP, that they also have opportunities over there. So those standards would also be good. That's why I'm surprised we don't have options to look at, for that to be a public document. But, I think they've got a huge role to play. So they need to be part of the strategy in terms of how we can bring manufacturers into the process and distributors. Dean has responded to Hugh. There are various intergovernmental structures, joint district and metro approach, etc., where collaboration can be fostered. Dean, I don't know if you want to come in. I'm not too sure how that comes together, so I think you'd be better placed to just give context to your response. Dean Gilbert, if you can come in, please.
Thank you. There are various levels of government and various departments involved with these structures. So I think you were also referring to where people in the waste environment or the waste departments, environmental departments can also speak to people in sanitation, housing, etc. So that you have synergies between the various departments around this issue.
Thanks, Dean. And I also see that you've responded in terms of SDK government is busy in the financial year to develop an integrated waste management municipal guideline for informal settlements. It would be great if those documents are available for others to review, to see application in other municipal areas when it is finalized.
Yeah, I think before it's finalized, we will circulate it for comment. I think the issue you mentioned earlier about contractors when it comes to service provision by municipalities through the subcontracting, I think that's an important issue that I think we will also address in the guideline. But yes, it will be circulated for comment, especially to the municipalities and other relevant parties. Yeah.
Can I just add to what Dean is also saying? I think in a lot of municipalities, the whole issue around contract management, and in the Western Cape, I know these things are all discussed at the Waste Management Officers Forum level, and we produce a procurement guideline also just to assist municipalities, because you're right, in the case where there are contractors, how to monitor them, how to ensure that they're upholding the requirements in terms of the contract. So these are things that definitely is also being discussed at when we have these platforms to engage across the at least within our province. And I trust that this would also be taking place in other provinces, where they have an opportunity to engage with those with the waste managers who are putting out the tenders and the contracts about how to ensure that the service level is according to the required standards.
Great, thanks, Belinda. I think that's an essential part of the whole strategy. So yeah, it's great that you've brought that up. And thanks, Dean, for sharing. I just want to check. So I've got, I think I've covered everyone's comments. If I have not, please put your hand up and feel free to take the floor if I've left anybody's comments out. Or if there's any further questions, please feel free to raise your hand. Is there anyone that wants to add or bring up your question from the chat box that I might have overlooked? No. Okay, so there was just one comment also from my side, is that it also seems, I was very glad to see that the waste pickers are such a centre sort of process and campaign in the Western Cape, because they play such an important role in terms of waste management and reduction of costs for municipalities in terms of processing waste. So, they're actually a massive service and support to municipalities. And I was wondering how, they could form part of this AHP management strategy in terms of, informing areas where there's high illegal dumping or dumping of AHP products. And I don't know how, I'm trying to think there could possibly be a way of how to integrate them into the strategy to further support sort of the waste management on the ground within landfill sites, as well as especially within communities. Is there any consideration around their role in terms of managements around AHPs? I can't think of how they would be, but there has to be some sort of integration, especially since they are such an important component.
If you want me to respond, I'd like to.
Yes, please, Belinda.
Yeah,
yes.
I think when one looks at where the problem persists mostly, it is where you don't have a proper waste management collection system in place. And currently those are mostly your informal settlement, your backyard dwellers, etc. And so one needs to look probably at some form of incentives. How do we build an incentivized system around just ensuring that waste type is collected and gets out of the environment. So mechanisms, incentive systems, we need to really explore incentivized systems to at least just get it out of where it should not be. And so there's obviously opportunity, and that's probably where partnerships with the manufacturers, and I think there's some interesting work being done around, that already in terms of the project that you is driving. But yes, maybe using some type, but also the appropriate incentives, and I think you probably will want to speak a little bit more about it. Yeah, but at the landfill site, that could be a little bit more complex, I think. But yes, I think you will probably want to respond to that.
Yes, Hugh has his hand up,
Yes.
so I'll open the floor to you, Hugh.
Thank you. Yes, Belinda, we are definitely, we have included incentives as well as, there's a behavior change methodology that we're running with, and it's investing in a reciprocity principle. It's investing in incentives to encourage participation in the collection system, and we are focusing on the ECDs. So the early childhood development centres, we are at the moment dealing with 9 of them in Langa, and they are a key support for enabling collection through their customers. So at the moment we've got something like about 112 to 120 mothers or parent stroke participants in the program. So that's the way we're running. Yes, in order to maximize collections, we've got the support and leverage of the ECD principles as well as the incentives. So we're putting quite a lot of energy and resources behind the whole incentivizing and supporting the convenience of the collection system. But the other thing is that, okay, fine, now we've got collections coming through to the ECDs, and it's starting to, we're tracking the weight of the in order to basically find out how the participation rates are going, so that our models are doing well. But then we've got, then we've got accumulated nappy material, which we've got to do something with. So because we are, we're funded by a big multinational with reputation issues and obviously responsibility issues. So we've had to find one of the, there's only one service provider who provides a Department of Health compliant collection from the ECDs, which takes it then to deep trench landfill through Averda services. So it's also a very expensive collection and disposal process. So we're wanting to, after the research has come up with models that work best, we want to then work with the ECDs and with the local community to see if we can continue to have the collection models that are most effective continued. So that means bringing in other partners, but it means reducing the costs of collection and disposal. So that's where we're looking at kind of democratizing, making the collection of materials equitable, because as you've outlined very clearly, there's massive amounts of compliance issues, there's massive amounts of obstacles to meet high level health standards. So we need examples of how to reduce the costs in order to expand the availability of effective collection and disposal systems. In the informal, we're working in backyard areas and lower income in those areas. So that's hopefully the examples that we will be able to do with the manufacturer funding will be able to be shared much more widely once we've got some good examples.
Great, thanks so much, Hugh. And I think that's actually what the nexus is for the strategy as well, is to find those case studies, because there's lots of different projects across South Africa that people are implementing different strategies in dealing with AHP waste. And it would be great to sort of have a feedback process on all these different systems so that they can help affect policy and guide municipalities into better management systems too. So that's great. Thanks, Hugh. And I suppose that's also, how can we as practitioners in the industry trialing and implementing different research, different practical approaches to dealing with AHP, how can we feed back to government in a more structured framework? I mean, what opportunities in terms of that the task force or municipalities in dealing with this issue? How can we develop a system, or if there is a system, how can we feed back into that system to inform management of AHP waste in South Africa or on a municipal level? Belinda?
Yes, obviously around policy development, you need to have good stakeholder engagement. And it is up to the government departments in terms of how well they advertise and ensure that that they have widespread consultation. So yes, I mean, obviously now they will. I suspect that there will be now coming forward a lot of engagement, especially from our national department. I don't know if Dumasani is in the. I don't see him here, so but yeah. So definitely from our side, I mean, we will do from our provincial side, try and get as many stakeholders to attend. But yeah, I think it's just about making sure that our national colleagues are really putting out, the invitation to as many people. I don't know how this is a new platform. There are new people on this platform, and I suppose they I don't know if they have the reach. I think it will be also using this platform to try and also access those, at least these people that are here, and then when those engagements are, whether it's online or in person, that the invitations are sent out. I don't know if I'm responding correctly to your question, if I missed something.
No, I think that's great. I mean, I think that's a good starting point, and then through that system, develop ways of feeding back in terms of documents, research, and case studies that they could feed back into that system to better inform the strategy and waste management. I was wondering as well, Lena, you're welcome to come in and ask or come in and speak if you want to. If you can, please feel free. Okay, well, Lena said we also need to look at initiatives that promote use of cost-effective green sanitary material that's acceptable to lower income groups, nappies and sanitary, in collaboration with the private sector, taking care of addressing the acceptance concerns linked to negative poverty connotations linked to use of reusable nappies and sanitary towels. Again, yes, I absolutely agree. I think that's where manufacturers also come, and we were speaking about earlier, that they are a central role in terms of developments of a product, distribution, and then management of the end product as well. Needs to be considered and included in the strategy. Belinda, I don't know if you want to add anything further to Lena's comments around making sure that green materials are used in sanitary products, but that also don't influence or negatively influence cultural considerations within the communities.
No, absolutely. Voices like Lena is important, when we have these engagements, so that these ideas can be taken forward to the policymakers around, the considerations. But clearly, there's a need for basic compulsory standards, I think, and the compulsory standards obviously would need to take a whole lot of these things into account, going forward.
Great, thanks so much, Belinda. Great. I see Don Govender has also said that his Linden Consulting is developing a national policy on the sustainable design and disposal of AHP waste, and we can email him. His email address is on the chat box there if you would like it. He also wants to be included in any discussions going further on this policy. Which also, I think I'd also like to take the opportunity now is that through Professor Schenk, and I don't know if there's other people that are part of the One Health Forum that we established in 2021 to research collaboratively the impacts and situation of AHP within the different communities of work that we work in. And through the One Health Forum, we conducted a situational assessment. We've actually put through a provincial report, and Professor Schenk has also since published some papers on sanitary waste on AHP waste in the Cape area as well as the Kruger to Canyons Biosphere Reserve. So based on that, we will be hosting a conference on AHP and the management of AHP in November, in collaboration, or should I say in association with the Conservation Symposium. And that will be run between the 5th and the 10th of November. And the purpose of that conference is to bring research, practice and policy together towards developing a community practice on AHP management. So Don, with that in mind, looking at your comments, it'd be really great for you to be a part of that conference that we will be hosting. And then obviously I open it up to everyone else in the group. I will share that information with you if you'd like to submit an abstract or submit practical case studies that you've been working on to present at that conference. I will share that link and invitation around that to you. Belinda, I know that it was a lot of pressure for you to participate and present today, but it was an absolute amazing presentation. So very informative. Thank you very much. It would be great if you could also attend that conference. I will share that information through to you, although I know that your schedule is quite packed, but it would be great to have your input on that.
I'll definitely try to attend.
Thanks, Belinda. Professor Schenk, I don't know if you want to add anything from your side.
No, thank you very much. No, just to say to Belinda, thank you very much, Belinda. I think, as always, the depth of your, specifically your policy knowledge was really helpful. I think in particular, I was very interested in terms of the conflictual, if I can call it that, policy issues between waste and water. And I hope that, yeah, it was very insightful. Thank you very much.
Yes, thank you. Belinda, I'm sorry.
No, I also want to thank Prof. Rini because it really caused me to be focused on this issue. And I think going forward, and there's a lot of work to be done, and we're starting. And I'm very excited about going forward about what comes out of all these engagements. And yeah, it's just good times ahead, I think, in terms of how we move forward on this. Thanks.
Yes, thank you. Yeah, I definitely, I mean, and in the light, it's so important that we're having this conversation and collaborating and having all these interested parties. I mean, we've got on this chat 53 people, and in our last webinar that we hosted, we had 110 people with various organizations and all across South Africa. That's just like a small little glimpse of how big this field is at the moment and how much interest there is around it. And on a global scale, AHP waste is becoming one of the priority areas of environmental and social impacts in terms of illegal dumping and in our watercourses and open conservation areas, and how that's impacting on people and their environment. So it really is a topic that needs to be addressed, and it's glad there's a lot of interest and a lot of role players in it. So I see that John has also asked if you'd be able to share the draft policy with us so that we can have inputs. I don't know if that's an option, Belinda.
There's a draft status quo which we are currently commenting on. I'll have to, it has been circulated to our department. I'll just inquire from our national colleagues if we can distribute, but I know they want the comments in already by the 31st of July. Their strategy is still in the process of being developed, so there'll be a lot of opportunity to take that. In terms of engagement. So I think it's the early stages, so there'll be a lot of opportunity for more inputs from the public, and there will definitely be more public consultations.
Thank you very much. Yes, and I will make this into a little video for everyone, and that will be, so lots of people have asked for the presentation, and I will make available the video to all those that attended and couldn't attend today. So very informative. Thank you very much, Belinda. Greatly appreciate your time, and your colleagues that assisted you as well, that you made mention before. So great that you're were able to present this very important aspect of AHP management. I see Rini and Professor Schenk and Don had their hand up, but Professor Schenk, please go ahead.
No, I just wanted to say, I thought I had the last word. I just wanted to say thank you to you, Cherise, for managing this very informative session.
Thanks, Professor Schenk. I appreciate that. Thank you. Don, did have your hand up? Do you want to say anything?
No, thanks. That's fine.
Well, on that note, thank you very much, everyone, for the audience for coming in today and participating and asking such great questions. It really enriched the conversation and the content around it. So thank you, everyone, and Belinda, Professor Schenk, for helping and organizing everything and rallying up Belinda to come and present. So thank you very much for everyone's input in today's webinar. And in that note, I close the webinar. Thank you very much.
Thank you. Bye.
Thank you. And
Thank
goodbye.
you.
Bye.
Thank
very
you.
much.
Bye.
All the best.
Thank you. Bye-bye.